Hello, dear doctors. Welcome at Dr. Rami Cardio Club. Today, I would like to share with you a new miracle of medicine in management of diabetes that would be very beneficial for our patients. Here we go. We have here Ms. Y. She is 60 years old, nice lady. She has diabetes for 15 years, hypertension, and hypercholesterolemia. She occasionally smokes a cigarette. She is complaining of shortness of breath, which has been progressed over last 3 days and associated with lower limb edema. On examination, her blood pressure is 145/95, pulse is 80, abdomen is lax, non-tender, and no organomegaly. She has pan-systolic murmur radiating to left parasternal area. Also, she has bilateral basal crepitations. So it gives me an impression she is congested. Her last blood sugar level was 190 milligrams per deciliter. She is on lisinopril 20 milligrams once per day, metformin 1000 twice daily, linagliptin 5, rosuvastatin for cholesterol. Her echo showed ejection fraction to be 45%, which is abnormal. It is reduced ejection fraction, which is explaining to us why she has edema and congestion. Which medication to be essentially added to her medications at this moment to improve morbidity and mortality? I see here that her blood sugar is not well controlled. It is 190 and she has edema and a cardiac problem. So what do you think will be the most appropriate action now? Let's give me a choices. Glimepiride, rosiglitazone, ripaglinide, exenatide, empagliflozin. Which one you think will be of a choice here? Yes, exactly. The correct answer is 5. Empagliflozin. Empagliflozin. Let's explain to you the answers. Glimepiride is a sulfonylurea. It is an insulin secretagogue. That would not be helpful here because it doesn't improve morbidity and mortality for any patient with a cardiac problem. Rosiglitazone is contraindicated here. All thiazolidinediones, insulin sensitizers like rosiglitazone is contraindicated in cardiac patient, hepatic problems, kidney impairment, especially if the patient is having edema because they exaggerate congestion and edema and body swelling. Ripaglinide is a short-acting insulin secretagogue, which is not favorable here. Exenatide, glucagon-like peptide 1, is not of a choice here, but empagliflozin, which is a sodium glucose cotransporter 2 inhibitor, is of benefit here, is of a choice. Let's see why. SGLT2 inhibitors are new era of oral hypoglycemics, which includes some members like empagliflozin, dapagliflozin, and canagliflozin. They decrease blood sugar level through kidneys because they inhibit sodium glucose cotransporter in proximal convoluted tubule, which will cause glucosuria and diuresis. They will relieve the blood congestion. They help in decreasing weight, and they also of a choice in controlling blood sugar level. According to European Society of Cardiology recommendations, SGLT inhibitors has been proven to improve morbidity and mortality in patients with heart failure, especially with reduced ejection fraction. Let's see the diagram which will show to us how they work. We have two types actually of transporters. SGLT1 in the proximal limb of loop of Henle and SGLT2 in the proximal convoluted tubules of the nephrons. SGLT2 inhibitor will be so powerful because 90% of glucose is reabsorbed here in the proximal convoluted tubule. So if I'm giving a blocker for this transporter, most of the filtered glucose will pass to the urine and go outside. So it will help in decreasing the edema, the blood pressure, and the blood sugar level. That's why they are ideal for patients with diabetes, hypertension, obesity, because he will lose weight as he is losing sugar outside, and cardiomyopathy. They cannot be used if eGFR is below 30 milli per minute per 1.73 meters square. Not because they are harmful to the kidneys, but actually because they will not work, because the nephrons are damaged. With this group of oral hypoglycemics, there is no risk of hypoglycemia, and they have proven to be weight reducer, and the most common side effect shall be urinary tract infection, because the urinary tract, and actually mostly in females, because they have short urethra, they will have multiple vulvovaginitis events, because this area will have much sugar more than usual, which is recruiting bacteria and fungi. So this will be the most common side effect. My beloved doctors, I wish you the best of luck in your end over. See you again and again in coming videos. Good luck. Bye.